Hey, I'm Blaise with MindForge Communicating. It just makes sense that my very first video would be squats. Anybody that knows me knows that that's my answer to pretty much everything. Back in 2008 to 2012, I was working with cardiac rehab as the lead exercise physiologist. The very first week, I came in, rebuilt the entire exercise program, built around squats, of course. And as you can imagine, there's a lot of pushback because squats have throughout the years been seen as, oh, they're hard on the knees or they're bad on the back. No, that's just simply false. Squats are very important because they build the muscles of your legs. So you have the quadriceps on both sides, those are on the front. You have the gastrocnemius and soleus that are on the back of your legs, your calves. And then you have your hamstrings, your glutes or your booty, and then your lower back. All of those get hit with every rep of the squat. And as you progress through it, you end up getting more and more benefit from the movement. When I was working the cardiac rehab, we had a 92-year-old patient can't come in. She was on a walker, the ones that you could turn and sit on. She would walk about 12, 15 feet at a time and then have to turn and sit. The first day of rehab, I had her come in. We went through our normal physical workup, and then I asked, how often do you do squats? She's 92, so the answer was obviously a resounding, I don't. I can't. So I took I can't as a challenge and asked, how do you get in here then? So I had her put her hands on her chair and just stand up. That is called a squat. It's a sit to stand, and we use it in rehab all the time. Whether it be a knee surgery, hip surgery, back surgery, it's going to pop in there at some point when you're doing physical therapy, and then it just gets better when you work with an exercise physiologist. That is the benefit of a squat. You'll notice that as you work through all of the parts of the movement, you're getting some ankle flexion, you're getting knee flexion and extension. Flexion is this, extension is this. You're getting extra work to all the muscles down here. And then at the very top of it, when you flex your lower back and your glutes, you get even more. So, how do you progress on this? What happened with this patient? At the end of the 12-week program, she was walking 3 miles a day and doing squats with the bar on her back at 92. No big deal. So, I have used this for the past 15 years as the basis of every workout I start for anybody I prescribe exercise to. So, here's how we go through that process. So, the first part, and obviously use a chair that's sturdy because this one is movie, so don't do that. For the this was the first chair I could find, so I'm using it. You want to start with having your feet flat on the ground. Notice how my knees are over my toes. And when you stand, your shoulders are going to go over that as well. So from here, you can draw a straight line, boom, boom. Okay, right here. To do a sit to stand with hands, this is the first step. So if you have difficulty moving, you want to start with putting your hands on the armrest. Notice how everything's leaning forward now. And then you're going to push with your arms and your legs. Okay? Push down, push up. Notice I'll take all the weight off at the end of each one. Okay? And from the front. Oh, okay. And from the front. Okay, so that is a sit to stand with hands. That is the very first step you'll take in this. The next step is sit to stand with no hands. All it is the same thing you just did, just without hands. So again, starting in our same spot where our arms were here, now they're here. Notice my upper body did not move. So we're not here, we're here. Arms across, stand up. Okay, and then from the front, down. Okay, so that is a sit to stand. Okay, so once you get to where you can do the sit to stand with hands and without hands, the next step is to do weight. You can do this in two ways. You can either get rid of the chair, so then it's body weight, or you can hold a dumbbell in front of you like this. So to do a body weight squat, so again, same spot. Now notice where I'm at compared to how I was in the chair. So I'm still knees over toes, shoulders over knees, same thing. And from the front. Okay. And if you're doing a goblet squat, you would just hold something right here. Luckily, I had a big rock laying around. So with the goblet squat, you'll hold it right in front of your chest, right here. And notice how my back stays tighter right here. So it's a straight line from my glutes to the back of my head. You're just up, down. Considerations for squat, these kind of shoes actually aren't the best. Wearing shoes that have a built up sole like this, now granted these are comfortable to walk in, but for squats, not great. They cause you to automatically lean forward. So when you're coming down, the first thing your body wants to do is knee forward. So ideally, you want to either kick your shoes off or get something flat. If all you have are walking shoes, that's fine. You just don't want to be doing a lot of big weights until you get that taken care of. Second one is feet positioning. Most people, I try to get to start with this feet at shoulder width apart. Myself, I tend to go pretty far out, more of a sumo style. So right here, which is going to do a lot more work on the inside of your legs right here. And back when I was doing bodybuilding, squats with feet together puts all the emphasis on the outside of your legs. Okay. So at the top of every squat, feet are flat in a comfortable spot. We're going down. Notice everything's tight. Notice I can actually sit here for a bit. So you're not trying to get to a spot where you're like crunched down. You want to get to a spot where you're comfortable sitting and then drive the hips forward. So you're here, drive. Here, drive. And at the top, squeeze your shoulders back. So you're here, drive, squeeze. Here, drive, squeeze. You don't want to do this and you don't want to do that. You want to keep your back flat the whole way through. So I filmed that all at once and it was a bit rough. Squats are a good workout. They use up a lot of energy, require a lot of calories to maintain, but they're one of the most rewarding exercises you can do. If you continue to build up, you'll notice that your knees and ankles not only feel and function better, but the pain's gone. You have these little sacs between your bones called bursa sac. They're filled with something called synovial fluid, which acts as a cushion, buffer. As you age, that sac gets smaller, and the movement, especially when you add resistance to it, that movement helps to lubricate that joint. You get more synovial fluid into that sac. Resistance training also has a robust effect on bone density, particularly in women who suffer from osteoporosis to a higher degree than men. Doing any type of resistance training, especially full body exercises like the squat, is integral to active aging, maintaining bone density, improving muscle density, and overall metabolic capacity. So the squat is the king, and I'm here to teach it. Every hour, do 5.